Okay, what a wonderful conversation with Elizabeth and Anthony to set up our panel conversation today, where we're taking a closer look at data and analytics, new sensor-based tech driving applications. A special thank you to the Connectivity Standards Alliance for especially highlighting this session, where we are going to be getting into what types of sensors organizations are using today. What are the business implications of incorporating sensor technology into home healthcare? How is the market expanding, and how are organizations really engaging consumers? We heard a lot on the last conversation about compliance, and engaging consumers to actually use connected health solutions is a big part of the challenge in working in this space, and then also navigating the reimbursement and regulatory landscapes. As a reminder, you can put any questions that you have for the panelists into the audience Q&A tab or the chat tab. We'll see them either way. And we also have a polling question in there, so don't forget to go in and take that polling question. So we have fantastic panelists today to really from a variety of perspectives to talk about what they see as useful and interesting and challenging, and the opportunities in kind of sensor-based connected health applications. Speakers from Alarm.com, IP Capital Group, Wellve, Anthropos, and Vyar. I'm going to ask each of them to come in and introduce themselves and tell you a little bit about the organizations before we dive into our conversation. So I'd love to start with Steve Chazin, who's the VP of Products with Alarm.com. Hi, Steve.
Hi, Jennifer. How you doing? I think I'm wearing the same shirt.
That's A-okay. Makes things easy. Thanks for being here. Tell us a little bit about your role at Alarm.com.
Well, I'm Steve Chazin. I'm VP of Products for Alarm.com. I've been with the company for about 6 years. Alarm.com is one of the largest providers of smart security and home automation, and we sell our products through a network of about 11,000 professionals, and we reach about 10 million homes all over the world. If you have a security panel on the wall, odds are Alarm.com's technology is powering it and its connection to professional monitoring services. 23 years ago, we were the first company to put a cell radio into the security panel. Not only did that make the panel more reliable, but it also provided telemetry from the home to start to learn normal patterns of behavior, so we can alert you when things don't look right. For instance, we don't know if you're opening a window at 2 a.m. to get a breath of fresh air, or it's an evildoer trying to get into your home, but we do know that's not normal for your home. And so we alert you to that to take action, even if, maybe especially if, you never even arm your panel. So over time, we built health-specific AI, like you see in this picture, to provide these glanceable insights to help families stay aware of pending changes to their loved ones, using many of the same security sensors like motion, door, window, and presence contacts. And you can glance at this and see that maybe there's an issue with somebody making more than normal trips to the bathroom. Now on the right, you see the smartphone. We're turning that smartphone into a sensor, tracking location, activity, battery, and a bunch of other variables to provide a new type of understanding, what I call wellness awareness, so that families can know their loved ones are doing well or they need a hand with just a glance.
All right. Well, we're so excited to learn from your and Alarm.com's many years in this market building these solutions, and what you're learning from those who are using your solutions. So thanks for being here. Next up, we have Nancy Edwards-Cronin, who's the President and Managing Director of IP Capital Group. Hi, Nancy.
Hi, Jennifer. Happy to be here. As you said, I'm President and Managing Director at IP Capital Group. IP Capital Group is an intellectual property and business management consulting firm. And we've assisted with companies with innovation, invention, and IP development for now 25 years. My background's in engineering and in management consulting. So although IP Capital works across all the industries you see there, and technology and industrials, healthcare, and consumer products and financial services, we are very familiar with the relevant areas for today of wearables and medical devices, Internet of Things, and smart home. And we've helped companies create and implement protective IP strategies that align with our clients' business objectives, their technology roadmaps, and their product launches. I'm really happy to be part of this group, and there's some great panelists here with terrific information. And I truly believe that sensors and advanced technologies benefit all of us, and have great opportunities to enhance our personal health, safety, and wellness. So happy to answer any questions that are not just sensor and connected health oriented, but some of the innovation and patent dynamics that may be behind the scenes.
Fantastic. Love to have that experience and expertise through your voice on the panel today as well. So thank you, Nancy, for being here. Next, we have Mark Kachatourian, who's the CEO of Wellve. Hi, Mark.
Hi, how are you, Jennifer?
Wonderful. Thanks for being here today. Tell us a little bit about yourself and about the company.
Well, thank you so much for having me. I'm Mark Kachatourian. I'm the CEO of Wellve. I've been a founder of the company. I developed the technology as a CTO, and then more recently have taken over the company. We feature non-invasive blood pressure from the finger using our multi-vital sign device that does blood pressure and 8 other vital signs. We also have a wearable and a weight scale on our platform to really provide not only clinical grade vital signs, but activity information and weight and body fat that all goes into our application. It gives you a lot of analytics and artificial intelligence on the direction your health score is going. I'm very excited to be a part of this panel to understand and kind of give my perspective of where the industry is going in the remote monitoring, the personal wellness space, and also in the fitness space.
Fantastic. Thank you so much, Mark.
Thank you.
We also have Paul Burney, who's the Chief Commercial Officer with Anthropos Digital Care. Hi, Paul. Paul, I think we're having trouble hearing you. Can you hear us okay? I think that's a yes. So we just can't hear. Come back to you in just a minute. Maybe check your audio settings for just a minute, and then we'll come back to you, okay?
Sure.
Thanks. We also have Michael Scaff, who's the Vice President of Healthcare Technology for Vyar Imaging. Hi, Michael.
Hello, Jennifer, and thank you so much for having me here. It's a pleasure to be on another one of these panels with you, and you guys always convene such interesting events. It's always a pleasure to be a part of these, so thank you for having me. As you said, my name is Michael Scaff. I serve as the Vice President of Healthcare Technology for Vyar Imaging. Vyar provides sensors in a number of different industries, including healthcare, but also in automotive, in defense, in retail, and a few other industries as well. Obviously, I'm focused on the healthcare aspect of this, so I'll talk a little bit about that. Falls, as we know, are a $50 billion a year issue, and we are taking direct action on providing solutions that help both solution providers and people in their homes catch falls and address falls. So really excited to be here with you. This is an important topic, and I really believe after serving as both a CIO and Chief Operating Officer in senior living and healthcare directly for providers in the last decade, as well as working in technology for the last 30 years, I really believe we're finally at a point with these sensing technologies that the technology is mature enough, the data and integration are at a place where it provides useful insights. And I really see this over the next couple of years as an important time and a really inflection point in the industry, along with folks like those helping support this conference with the Matter standard. We have the standards in place, the technology is mature, and all of the aspects have come together to make these sensors really drive real value. So thank you again for having me here, Jennifer.
Wonderful. Thank you for being here, and excited to get into some of those items that you mentioned there. Paul, I'm going to go back to you. You're not muted on our side, so we'd love to bring you in again and see if we can hear you now.
I don't know whether you can or not. Can you hear me now?
I sure can. I can. So
maybe
yeah.
Maybe it's just the time delay of me talking to you from England this evening.
Well, you do already get bonus points because I think you're up the latest, and
It's
thanks for
9 p.m.
staying up with us. Tell us a little bit about your organization, about yourself.
So I'm the Chief Commercial Officer at Anthropos, as you said. So Anthropos is a connected care platform. We put combinations of devices and sensors into the homes of seniors. We use that data from those devices to build a rich picture of their life based around understanding something about their environment, their daily routines, patterns of behavior, physiological well-being, and safety and security. We then use machine learning to look for any change in any of those 4 aspects of their lives, turning the data about them into intelligence that is used by families and caregivers to make better informed care decisions.
Well, thank you for being here. It is all about the intelligence, such a critical part. It's not just about the data, it's about the meaning. So thank you for being here.
Pleasure.
Okay, so with that, I'd love to open up to the full panel here. Nancy, maybe I'll start with you. Really thinking about, again, we're focusing kind of on sensors and data today. You're advising or investing in or touching a variety of different businesses. Can you tell us a little bit about how those organizations are thinking about making use of data from a variety of sensors and what that means maybe for their business strategy?
Absolutely. Something that's kind of fascinating about this space, and I think that some other home-based, smart home technologies fall into this category, that we see this really interesting confluence of multiple industries. And it was referenced earlier by you when you talked about the separation between medical devices and connected devices that may be non-medical. But I can see both in the market and product space and in the patent space that we see there's probably a few more, but three general entities. And one of them is that medical device group. And those are companies that you all know, like Masimo and Philips and Medtronic. And those clinical level devices start to evolve and morph into home-based type of units. So that's one group. Then there's also home management systems, and that's a really big basket that would assist with presence detection, imaging, voice interaction, maybe for just personal information or tied to alerts or alarms or third-party services. And our panelists can really speak to that. They cover a variety of that portion. And the third are the wearable devices and the mobile devices. It's kind of a bring your own device space where, I've got my Fitbit on my wrist. You might have an Apple Watch. You've got Alexa. You've got your mobile phone. And all three of these groups bring something to the table. And it seems that there's this interesting dynamic of how you stitch them together, how you provide an integrated platform that delivers real benefit. And that's really where the trick is here. Can you get the right mix of sensors, data, and analysis to produce insights and recommendations that are meaningful? And that's where we see the most opportunity happening. There is a convergence. The information is there. The technology has caught up. Can you make it work and can you make it meaningful? And we see that both in the product and market space and what is mirrored in the innovation development and the IP development.
Yeah, absolutely. Now, one of the things that you're mentioning there, kind of the integration of the data and making it meaningful. We certainly see that from a big picture perspective, it really changes both from the consumer side and the provider side, almost that relationship between the doctor and the patient, how you actually experience healthcare. I thought I might go to Steve next and then Michael to talk a little bit about how insights from sensors are maybe reshaping that patient-doctor experience.
Yeah, I think it's reshaping it for good. I think there's two major trends, and we just spoke about them. First, the wearables now are providing normal people with an understanding about what's happening inside their bodies, right? In the past, only doctors had access to the tools that could determine what was going on inside a person. Now, even very healthy athletes are strapping on these devices, and this is directly translating to improved health and even better performance. And that kind of leads to the second major change. Our mobile phones are rapidly becoming the central store for our health data. In the past, our records were stored on paper in our primary care physician's office. And now my phone has more up-to-date current information about my health than my doctor has. It's pretty remarkable. My son, Jonah, who's a resident doctor in Boston, told me during Thanksgiving that during an overnight shift there last week, 3 patients arrived in the ER presenting with chest pains, which in the past would have required a whole bunch of tests, but they just looked at their phones, and thanks to their watches and their phones, these doctors knew immediately they were in AFib and they could be treated quickly. And I think the sort of third benefit of all this stuff, and it's just starting to play out now, is that access to these devices is enabling us to be more responsible for our own health instead of abdicating that control to others. And both of these changes are making for a more engaged patient, which is something doctors have been praying for. So I think wellness awareness will help improve the health of all of us and lead to better living.
Awesome. And Michael, too, I know that you have kind of vast experience also, particularly in senior living type facilities. Are you seeing sensor-based care maybe changing how patients are cared for and how staff maybe even work in those settings?
Absolutely. And you touched, I think this was touched upon earlier, both first by Anthony around adherence, because now that the technologies have evolved to the point where A, they're becoming a little more discreet and a little easier to use. B, they're integrated a little more seamlessly into our lives rather than being so either invasive or sort of interrupting our daily life flow. And also, as you just asked, in the senior living context, both post-acute, long-term care, we're starting to see adoption of these technologies in there, both for the clinical value as well as for the efficiency that helps drive staffing efficiency. If staff know where to focus their limited attention and time, that really helps drive value in clinical care delivery and make sure that they are prioritizing those people who need the care most and who may have an issue that they need to address more immediately. So absolutely, it's improving workflows, it's driving efficiency. And also, again, the technology and the sensors themselves have evolved to the point where A, they're less expensive than they were before. And they're also, and this is an important point, I think, too, the quality of the data and the quality of the sensing has improved significantly. For a long time, the worried well, as we talked about, we were wearing wearables for a long time that provided some decent information, but we're finally getting to the point where the clinical value of those data are actually becoming real and useful. So it's an important transition into the utility of those data.
I do want to focus sort of on the sensors and the data themselves. So Michael, sticking with you for a minute, and then I'll make sure that we bring in Paul and Mark here. Tell us a little bit, Michael, about how your imaging solution works and sort of the use cases. I'd love to understand, from the panelist perspective, exactly what types of sensors you're using and data paths that you're finding particularly helpful, and maybe there's sources of data you might have thought would have been interesting and helpful and impactful and isn't. So Michael, would love to start with you there.
Absolutely. So we are a radar company. We make a specific type of sensor, and we have used those radars to do everything from cancer detection. I think the first application of our radar was actually to detect breast cancer, but we now use it in senior living operators, for example, to detect falls. So that's often used either separately or uniquely for fall detection. We do presence detection. We work with companies like Paul's and others to provide a holistic view of what's going on in these environments to really help show when conditions change, when somebody's habits or patterns change as well. So you can infer certain things based on those data, and also be part of an overall picture. In some cases, obviously, we can tell you with a pretty amazing degree of accuracy when someone has fallen, and do so in a way that doesn't interfere with their privacy. We're not putting a camera in their bathroom or anything like that. We have a radar there that can't see anything more than a shape, but it sees enough of that shape that it knows you've fallen, and with a very high degree of accuracy. So I think it's important to look at the types of sensors and what's being done in combination. So as I said earlier, workflows are very important because we can't interrupt the nursing workflows. They're already overwhelmed. We have so few nurses out there, and that's getting worse, not better. So the staff need to be very efficient about the care they're delivering. So we need to make sure that the alerts that we're delivering saying someone has fallen in this room, we don't want them to have to carry around 5 different devices. They need a single device that we integrate that experience with and make sure that the alert gets to the right person at the right time to really make a difference.
Okay. So then, Paul, you're taking a variety of sensor information into your intelligence platform. Tell us a little bit about that and how you think about the different sensor inputs that you're looking at.
Yeah, I mean, we've got 2 big kind of areas of focus in terms of the types of devices we use. As Michael said, actually, we're pretty big users of VR devices, both in senior living facilities or care homes, as we would call them here. And also people living on their own in the community. And the focus we have on falls is only natural because it's the #1 reason in the UK that older people end up in hospital that is avoidable and preventable. It takes up more than 4% of the entire health budget of the UK, dealing with the consequences of falls for seniors. So, anything that we can do to spot falls faster, to find hidden falls, to reduce the long lies that people may experience from falls has got to be a good thing all around. So that, there's a kind of a focus on falls management. The other product that we focus on uses a combination of sensors together rather than a single sensor. So it's Steve mentioned them earlier on. It's kind of motion sensors, door sensors, smart plugs, that kind of thing. And we're using those in a kind of combination, what we would call sensor fusion, to create data about activities of daily living. And so the more important thing for us is kind of not what the individual sensors are, but actually how we combine the data from those sensors to create a better picture of what is happening with that person when they're living on their own. Because what we're really trying to do is to say, can we give you a window into the life of that person and what they do and how they behave when they're on their own, so that what we can do when they are also receiving care or they've got a family member caring for them is you can combine the observations that those family members have or carers have with the unobserved data of what the person does when they're on their own and create this better, richer picture. And when you know more about people and know more about what their care needs are, it allows you to make a better informed care decision.
Are there any sensors that or data types that you're not currently using today that you see as big opportunities, or sort of conversely ones that maybe you've tried and then said, well, that actually doesn't tell us what we need to know, and sort of through trial and error put out?
We're testing new devices all the time, and we've integrated 54 different devices into our platform at the moment. There are tons of things that I know will be part of our future. So, and others mentioned them already. Steve mentioned them. The idea of using Apple Watches and phones will become common part of what we're doing. It isn't today, partly because there's an economic barrier to using that at scale here in Europe. There have been some really interesting devices and sensors that we've tried that we've had really strong pushback from seniors about. One of those, amazingly to me, is smart light bulbs that turn on and kind of light up the way to someone going to the bathroom during the night. They hate them. The UK seniors, they just wanted them taken out of their rooms and out of their homes. And we tried lots of different colors and lots of different ways, lots of different devices and types and locations for these, but they just don't like the idea of them turning on during the middle of the night. And you have to go, at some stage, you have to go with kind of user acceptance of what people want.
Yeah, that's really incredible to hear, because that is one of the first use cases we think of is lighting the way to the bathroom to prevent falls.
Yeah, you would imagine it would be a natural thing to kind of help people.
They just want a light switch.
Yeah.
Right. Well, so Mark, it was interesting when you were giving your introduction, talking about really a multi-sensor, device all in one. And there's always this sort of debate about, do you go with unique sensors that are just, point solutions, or is a multifunctional device, a better way to go? Tell us a little bit about how you think about that, and what's either vital signs you're trying to pick up, or what's appropriate to bring into a more multifunctional solution like yours.
Yeah, no, we've definitely found that first of all, we're interested in both the clinical grade information and also wearable information. So with the combination of those two provides a very unique picture of a person's health. In our vital sign monitoring device, the multi-vital sign device I discussed earlier, we're doing non-invasive blood pressure, heart rate, SpO2, respiration rate, temperature, and a number of other blood flow parameters for your circulatory health. So we find that having one device as opposed to multiple different devices where, people have enough, if they're in, under remote patient monitoring plan or chronic care management, they already have enough challenges on their own. They don't need to be managing multiple devices. They need one device, place your finger in it, get the information accurately in 2 minutes, add that to a wearable that's on your wrist that gives you activity and some of your, your heart rate variability over time. All our sensors are light touch or in some cases, even with our thermometer, no touch. People don't want to be bothered during their day. Interestingly enough, some of the groups that we work with, they don't actually want to use the wearable. They feel that's an invasion of, some of their activity and their privacy. They just want a spot check of their vital signs to know how they're doing. And especially their family members are exceedingly interested in that, right? So being able to take that data from our device via Bluetooth, and then our next generation will be 100% cellular, Cat 1 mobile, and getting that information to the family members and the care providers for remote monitoring, senior living, chronic care management is essential. But all with sensors that are giving clinical grade information, and aren't aren't invasive or aren't pricking or disturbing the person's daily existence.
Yeah, I think we found that in some of our data as well, especially for the older population being more hesitant to wear something. They may prefer a traditional watch, or skin sensitivities, not wanting to wear something all the time. Just as a follow-up to you, Mark, I'd love to hear, from your perspective, we heard a little bit from the previous visionary speaker conversation about the issues with compliance and engagement and getting, especially in a remote patient monitoring situation where there needs to be, compliance and showing daily engagement rates. Can you share anything from what you're seeing in the programs that you're involved with?
Yeah, we've had to implement basically gamification in our application. So if you tell someone you need to do this 16 times a month, for this project, that doesn't motivate them, right? That's just, okay, that's a task I have to do. It's just another thing I need to worry about. What we do is in our application, we actually calculate health scores based on clinical grade information. And that provides a very unique insight. And that turns it from, hey, instead of just getting 9 numbers on your phone, your blood pressure, your heart rate, which you don't entirely know what that means, and it's a little bit overwhelming, even to people who do know, of turning that into a score and turning that into a game of like, look, you know what? Instead of saying, oh, my blood pressure is always high, saying, hey, look, I'm at a 78 Welvy score. I need to get to an 80, right? That really starts to bring, the personal aspect into the health monitoring. And I think that, and a number of other folks have mentioned this, that, turning things, getting people engaged, and turning it into a score is a way to sort of, it's a very thin barrier, but it's a barrier that makes people not feel self-conscious of their health. Just like it's easier to talk to an avatar than a person and admit you have, that we all have health issues, right? So really that gamification, doing like, instead of there's a stress test when you have a heart issue, you have to, every 6 months you go in for a stress test where they wire you up. It feels very clinical, feels like an invasion of your space. We've implemented a fitness challenge, Jennifer, in our app where you do your vital signs, you exercise, and then you do a measurement after to see how well you recover, right? And that says, instead of saying, oh, it's a stress test, it's a fitness challenge, right? Bringing it into something that's a little bit more easy for people to manage.
Yeah, that makes sense. Steve, maybe over to you next about how you're seeing, users engage. I know from talking with alarm.com in the past, you certainly have, first of all, a unique channel of how you're reaching customers and onboarding them to their platform compared to maybe somebody coming from the healthcare side. So how does that impact how customers find you and then how they're actually using the platform?
Yeah, we're kind of unique in that the customer's customer is actually using an app that doesn't necessarily say alarm.com. It may be one of our partners' brands. So we don't kind of get the benefit of the lift for that. But what we focus on is making sure our products work reliably and that they're secure. But what's happening now is interesting is the demand for these types of tools beyond like the traditional home security. You can almost thank Apple a little bit for it, for marketing the benefits of this consumer health technology, which was an accident for them as well with the Apple Watch. They never really wanted to go into this space, and it pulled them into it. Now they tout features like Find My, like satellite SOS. They have fall, crash, and AFib detection. And they've started most of their recent events showcasing actual customers whose lives were saved using these products. And that awareness is a tide that lifts all boats. We live in a world, this stuff didn't exist 5 years ago, and it takes an Apple and other big companies to excite people about the possibilities. At alarm.com, we're fortunate to be the app even if it's not our brand and our partner's brand, that people trust to keep their homes and businesses safe. So it's a logical next step to use the same app to keep your family safe, right? And we're able to provide a more complete solution and more context than even Apple based upon what sensor fusion we discussed. We have a bunch of other signals in the home that can augment the wearables and the devices. So now instead of waiting for an emergency to happen and then calling 911, a lot of our products provide an early warning system and can also backstop these busy families with specially trained professionals who can act on their behalf. And it really helps check that box of safety and security in their brain that they're doing everything they can to take care of the ones they love.
Now, I have to follow up with you as well about smart lighting, because certainly, as a smart home platform and a security platform, smart lights are one of the top selling, smart home devices. And so, can you share anything around whether or not smart lights are commonly being used in a care situation, or is it more about the learning and the sensing from the sensor technology? Anything that
it's
that
so
you want to say?
exciting. It's one of those spaces where it does so many different things, but in many cases, a senior just wants a light switch, right? They don't want something being controlled that they don't understand. But that same signal coming from the light bulb can be used in a bunch of different ways. A lot of these smart bulbs work on Bluetooth or Thread or Wi-Fi. And when someone walks through that space, that provides a signal invisible to them that there's somebody there. So now you have an awareness or presence sensor in a light bulb that's just behaving like a light bulb. We actually have these little smart plugs that we've been working with that do the same thing as you plug anything into it, control it like normal. But since this has full-time power and it's on the Wi-Fi network, we know you're in the room. In fact, when I leave my office, these 3 plugs know I'm leaving and turns on the lights in the hallway as I approach the space I need to go to. But of course, I like that. So I know it's me controlling it. But this is just the beginning of using the existing sensors in people's homes to augment their understanding of, are they okay or not? My own dad, I have a bunch of stuff in his house that he doesn't even know about. And I know whether it's time to call him because I see the activity level sort of settle down. I know he's in his home. And we had this discussion a long time ago. One of the things about privacy is seniors don't want wearables and they hate cameras. But I made a prediction 4 years ago that cameras are going to be the thing that, like you have when you have a young child, baby, it's the first thing you think about is keeping eyes on someone you love. Eventually, it becomes an act of love, not an act of surveillance. And you actually want these things to know that everyone's okay. We're now being trained that we can track everything all the time. And when that signal disappears, we have the anxiety.
Yeah, absolutely. And we've seen in our data that definitely cameras are the most sensitive, device that video stream. The ability to monitor what's happening around the perimeter of the household, very appealing across age groups, but the inside is where you start to get some sensitivity. And are you crossing a line? And is there maybe a dignity piece there? One other thing I wanted to talk about related to sort of consumer engagement with Michael and then Nancy, I'd love to come to you to talk maybe about market expansion and how the organizations you're working with are thinking about kind of where they're going next and how to expand their business opportunity. But Michael, I think one thing that we talked about was the importance of consumer education and helping the users and perhaps also the clinician side better understand these technologies. And also, if they get the data back, they're also improving their own awareness of what's going on. Can you share anything about, the importance of consumer education or things that you see as particularly effective there?
Absolutely, Jennifer. And it really depends on who you're talking about when you're talking about a consumer, whether it's a nurse who is consuming alerts from a fall detection device, or an end consumer who's living in their homes, or a family member who might want to be alerted if someone has an issue when they're many miles away. So I think the context matters there. It's important to think about the fact that ideally we're interrupting people's lives as little as possible. We're changing people's patterns as little as possible, as several people have already said, because we as humans don't like change. We don't change very easily or very quickly. So the more we can put things in place that simply work around our existing daily life and activities of daily living, as we talk about in senior living, the better, because then you don't have to educate anyone about what those changes are. You just go on living your life. You go on delivering care in the same ways that you were before, but you have more information. You are better able to provide more active care to those people who need it the most, and really prioritize things, but without changing what you're already doing. So to me, that's the most effective approach here, is when you don't have to do a lot of education, because it naturally fits into the workflows, to the life that we're already living.
Yeah, that reminds me of something we talk about in the smart home industry a lot, which is, the best user interface is no interface. When you can have something that's created automatically and is happening in the background, that's when you've hit real value.
Right.
So Nancy, I wanted to go over to you in thinking about market expansion. You need rising familiarity and consumer education to even understand, and physician education, understand that these types of solutions exist. How are the companies that you're working with thinking about growing their businesses and their presence in the market?
So I think I can bridge off of the points just made on consumer adoption and use. For the younger generations, they're going to embrace this. So I think the landscape is wide open for developing uses as those groups get older. Both Gen Z and millennials already highly use technology, as we know, but there was a study that looked at how different generations are using their technology, and close to 80% of those two categories use at least one form of wellness technology on a routine basis. Whereas if you flip that to the baby boomers, it drops to just shy of 30%. So while you've got this really great opportunity going forward for the generations rising up to get integrated with wellness, like gamification, especially integrating kind of fitness and wellness in with treatment of conditions and health. If you're looking at the baby boomers and and those who are kind of averse to age tech, the challenge of adoption is really making it easy for them to use. And we're discussing this already, but we're hearing our clients and companies talk about how to either have a simplified user interface, or, Jennifer, as you said, no user interface. Like, how can you make this so intuitive that it's easy to use, non-invasive, and how can you have tutorials in place? How can you have fewer things to connect, fewer wires, fewer things to plug in? Because if you don't have a caregiver on site that can do all of this, kind of your personal IT and device manager, it has to be simple enough for the consumer to use directly, or controlled remotely. So these are the types of challenges we are seeing, because you've got the sensors, you've got devices, you need to assemble them in a package and a delivery to the customer, that will ultimately be used instead of put in a drawer. I've seen this already, something gets unplugged and just put away. It's too hard to use. And that's not the objective here.
Yeah, I think that's such a critical point, is the, you mentioned tutorial, helping, especially at that setup point, so that it doesn't just go right into the drawer. Do you see natural channels for perhaps more human support in that setup, installation, or support methods? And what I mean by that, I'm sure Steve will want to jump at the bit here, because you've got security dealers who, could potentially come to the house and actually play that role, but then also home care aides, right? There are other home care workers that can come into the home, might not be technologists, but understand the health side of things. Is there anything in the businesses you're working with who are looking at that more human support services angle?
So I think in tandem with the advent of AI and how that's becoming more ubiquitous and useful, there's definitely a role that companies are looking to integrate with AI, not just for the data analytics, but interacting with the customer. And that way you can streamline, the interaction that needs to be personal. So can you get enough data such that an interaction with a human is targeted and effective, so that your service team already has information, and it doesn't start from that really annoying place of, well, do you have power? Is the thing plugged in? Have you tried these 5 things? They would already know something about the system that's given to them through the sensing of the data directly. And I think this mirrors some of the the lack of, or the decline in healthcare workers that are available. Similarly, you'd like to be very efficient with your maintenance and implementation and upkeep of any of these systems.
Absolutely. So I wanted to bridge off that, talk about AI for a second, and then we've got some great questions coming in related to reimbursement, no surprise, related to data privacy and security, and also the quality of the data. And so those are all great topics that we wanted to tackle. But first, I wanted to follow up when we were talking about it with AI, and Paul's probably the best person to answer this. Can you tell us, we obviously see a lot of application of AI in healthcare today, also a new whole wave of potential generative AI tools. Can you give us a little bit of insight into how you're applying AI today, and maybe where you see that helping to expand the market or expand the use cases, and the ways in which solutions can be delivered or help?
So I think from our perspective, the market's likely to grow in three clear ways. It'll grow because we add more connected devices. It'll grow because we connect to more other systems. But it'll also grow because of the power of the analytics and the machine learning that you're doing. So today, what we do is we compare a person to themselves so that we can see when their behavior has changed. And we've started to work on comparing that person to other people who look like them. So kind of cohort analysis. Beyond that, the next stage for us will be to use much larger data sets. So we're looking at kind of integrating with population health size data. So for the whole of the UK. So what we eventually get to the point whereby our machine learning will be able to see a single individual event taking place for one person, compare it to themselves, compare it to people who look like them, and know that in the past, the last 10 times we've seen that kind of activity and that kind of event, it has led to either outcome X or outcome Y, depending upon whether you intervened and when that intervention was made. That's the kind of direction that we're taking our company. We are very much focused on building the engine that does that, less interested in kind of being involved in the creation of devices. That's not our world, or the installation of those, or even the interpretation, the use of the data at the other end. It's much more about that, creating a machine learning engine that can take any data in source and transform it into intelligence about care decisions. And that is really, that will take huge amounts more data and a great deal more kind of machine learning capability on our side. And we've started to hire data scientists, that kind of thing. But that's a very clear direction. It's kind of akin to the vision I have for Anthropos, is that we'll become like the Intel inside of the connected care world. You won't necessarily see us as the leading brand, but what you will know is that the intelligence that's used in somebody else's care service is powered by Anthropos intelligence. That's kind of the direction I want us to go.
Yeah, it's fantastic. I think everybody who would love to have sort of engine inside, right? The rest of their solutions are sort of chomping at the bit for that. Can you tell us a little bit about how near that type of future is, and also are there some barriers to accessing the type of population health data that you'd like, or are the data integrations starting to flow more easily?
Yeah, so I'll answer that in the reverse order. Does the data exist? Yes. And it became more readily available in COVID, where government started to unlock lots of NHS data, or the National Health Service data here, to say we need this to look at respiratory problems. So we know that it's there, and we know we can integrate with it. We have already started enabling other people's businesses to be able to do this. So a lot of what's delivered in European markets traditionally has been telecare. So a kind of button in a box, the press the button and you get through to an alarm service, that kind of reactive care. But the businesses that deliver that are now interested in saying, okay, but we need to now add in proactive and preventative care at the same time. I guess a lot of them spend time thinking, well, we'll build it ourselves, and then they realize it's actually pretty difficult to do the remote monitoring and management of so many thousands of devices. And so now what we're doing is we're kind of enabling those services for them, as I say, kind of sitting in the background as the enabler of that to happen.
Awesome. Okay. So I want to take an audience question here, which is perfect because we wanted to talk about this anyway. So Michael and Mark, I'm going to come to you about reimbursement. So one of our audience members asked, are any payers reimbursing for the devices or paying the healthcare providers for reviewing the data? Very critical if you're not going to be direct consumer pay model, right? That you understand how reimbursement is working for some of the solutions. So Michael, if you want to comment on that, and then Mark, if you're what your experience is on the reimbursement side.
I'll say there are a couple of different reimbursement pathways that I'm aware of, and Mark can speak more to this as well, but you have RPM and RTM, you have chronic care management. So they're both, whether you're looking at these as individual billing codes or as looking at how you're billing for the services and the maintenance of health remotely. I will also say for a long time, hospitals and care providers have paid attention to discharge and what happens within the 30-day window following an acute discharge, because they lose reimbursement if someone bounces back to acute care within that 30-day period. So there are a number of different areas around reimbursement that we're interested in and working with. Mark, you want to go ahead on that as well?
Yeah, for sure. So the payers are not, you don't get reimbursed for the device itself, right? You're getting reimbursed for the service you're providing, the data, reviewing the data from the device periodically. So the CPT codes that apply to us are the remote monitoring codes, the 459s, the 458s, where it's looking at the data, it's getting vital signs at least 16 times per month, and then it's reviewing that data for at least 20 minutes per patient per month. So the device is included in that. There are a few applications outside of the reimbursement model where we're working with senior care facilities where we're actually providing the data to family, right? And then the payers aren't going to be paying for that because that's not reimbursed under the various CPT codes.
I will say as well, though, if I may, Jennifer, that there are some insurance companies that are also interested in this too. So outside of the sort of traditional payer side, insurance companies want to reduce risk, and risk shows up in a lot of different ways. So they're still, I think they're a little tentative in some ways, but they're starting to step into how can we reduce risk and how can we reduce payouts in different ways by using some of these technologies, as long as the data is good, as long as the telemetry is there. So we're seeing some exciting opportunities emerge.
Yeah, the information that the insurance companies can get from a extended period of time of monitoring a population, a group of people, is very, very valuable for their actuaries.
Absolutely. Thank you for sharing those thoughts. So one last topic. We only have about 5 minutes left, but I wanted to make sure that we talk about the issue of data privacy and security. We did get a question from the audience in that, and I know that we've talked about how important it is to build trust, that if you're going to be let into somebody's home, especially if it's not just, really, whether it's prescribed in a kit that's coming to your home and you have to trust that your data is secure to have that compliance and that usage, or you're actually going to pay for that service yourself. So Steve, maybe you can comment a little bit on how you protect the data and the privacy of the user, which are slightly different things, and kind of build that trust with. In your case, you might actually have a payer or a buyer who's the family caregiver, but then a user who's not necessarily the buyer. Tricky relationship there.
Yeah, for sure, Jennifer. I think, look, there's three major things you need to do and one optional one that's emerging. The first one is just understand the nature of the company collecting the data and make sure they have the same interest in mind, right? Are they a business solely focused on your health and safety, or do they want to mine that data to sell you something else, right? And if you're not in the same business, you've got a challenge with that one. The second thing, and we think about this all the time, is you got to make sure the products that they sell and support, they're buying from reputable suppliers, and they can only connect through a private VPN. You don't want things over the public internets if you can avoid it, because there are people that can listen to that information. I think the third thing is make sure the businesses are HIPAA certified, that they're actually taking your privacy important, and find out who in the company can access your data. This has been recently, major companies in the consumer space don't have rules on who can access data, and therefore, inside those companies, they look at anything they want. In our companies, not even our CEO can access data. There's a private group of people who are the only ones who can access the data and run reports, even for our partners. And I think the optional thing is, make sure they start to move away from passwords to passcodes, which is a biometric component only you have. The problem with passwords is they can be hacked. You can be socially engineered. Companies you trust can have their employees socially engineered. But if they're using your face or fingerprint as the access control, none of that stuff exists in the cloud. So it can't be stolen. And I know this because we work for a company that does all these things all the time, because security is what we do. And it sort of lines perfectly in the healthcare segment.
Great comments. Okay, so our last comments are going to have to come from Nancy. I'd love to come back to you to maybe give us a preview into, what you're looking at, how you're looking at this market coming into 2024. And you mentioned in your initial commentary about how you're advising clients on kind of their IP strategy, which I do think is really, really valuable. So if you'd like to share anything on, some practical tips that anybody in this space really learn about that, thinking about their IP, and also just, again, what you're looking forward to in 2024.
Sure. Yeah, partially my initial comment on that sensor fusion and then getting intelligence from it, which a number of the panelists have talked about. What can you suggest or recommend based on the data? And then if you enhance that with AI, we see the future as getting intelligent answers, from the inputs, but then looking at those patterns and being able to predict and prevent. So yes, you can track wellness. Yes, you can, keep track of your current vitals, but can you avoid something that could escalate, go from, a minor issue to an acute or a catastrophic issue? And so in the invention space, there are quite a few patents already on base devices, base sensors. A lot of that is very well known. What's not well known necessarily is how you take the integration of those streams of data and produce something that could not otherwise be known. Either not unless you physically combined those sets of information, or perhaps you could combine it, but not in time. So if it is, edge computing to assist in getting a more real-time picture and a preventative measure, to intervene, to give information to either the user or a caregiver to prevent something from happening. That's where we see a lot of this going in the IP side. And, a lot of that is happening in the market as well. So there's a difference between what you see with the products versus the IP. I see that they are starting to catch up with one another, and there's still a healthy amount of opportunity space in intellectual property, either through trade secrets or through patents, to protect what all of these companies are doing, to advance in the space.
Thank you so much for sharing that expertise with the audience, who I know are all businesses working in this space, and so very much would value that insight. Thank you all so much for sharing your time with us today, for participating and sharing your learnings with our attendees. Thank you all.
Thanks for the
Thank
invitation.
Thank you.
And of course, I'd also love to thank our sponsors once again. We had a great Connected Health Summit series this year, both our in-person event that was co-located with Connections US this year, as well as our virtual conversation